Hello, everyone. Welcome to this special OET All-Star session on writing. My name is Milen Jacob, and this is IRS Group. If you're able to watch me, hear me, please make sure that, just in the chat box, type in where you're joining from, your name, so that I can just keep track of it. All right. Here we go. Just need to make sure that you're able to follow me. We're going to look at how you can convert the case notes in writing, in OET writing, into an absolutely fantastic letter. So, good evening, Leif. Nice to see you from Philippines. Rowena from Saudi Arabia. Hello, Thomas. Thomas Kuti. Hello. Hello, everyone. Good. Sarah from Riyadh. Nice to see you. Yes. And I'd also like to know if you have an exam, an OET test, which is upcoming. All right. Ahmed from Egypt. Elvan from Myanmar. Blessy, good evening. Deepika from Nepal. Al Monalisa from Saudi Arabia. Hello, hello everyone. Justin from Philippines. Good. Sheetal, hi Sheetal. Good to see you. Right. So, I'd also like to know what your expectations are about writing, which perhaps I could cover today. And we'll be really excited to help you in succeeding in OET, in being able to work in the English countries where you want to. Yeah. Shivam is preparing for July 23rd. Mohammed from Sudan. Anika from Pakistan. Hello, Aji. Durga. Hello, Durga. Alan from India. Yes. Ahmed, you have got an exam on 27th of August. Excellent. Great. Good to see all of you. And this is going to be one session where a lot of your questions and concerns about OET writing will be addressed. I'll try to make it a simple process so that you can seamlessly do it. Hello, Anish. Archana, hello. You've got an exam on 6th of August. Leif on July 28th. Sanya, hi. Pooja from London, hello. Hello, everybody. And if you want to follow up, please let your comments on the chat. We'll be following up with them. So let's, Frida has examined August. Excellent. So here we go. So what we're going to look at today is how the case notes are going to be converted into a letter and yet keep the accuracy intact. We'll look at summarizing Leif, definitely. Hello, Mary from Kuwait. Hello, everyone. Yes, so you're going to look at what happens to the notes because the test rubric, the question set is a set of case notes. And so we're going to look at how they are transferred, how they are transposed into something different, which is the letter. Now, if you look carefully at the end of the writing task, it's one of the standard instructions that you have to write in complete sentences. So that's something which should be on your mind. But I want to know what concerns you go through every day, or when you're practicing how to write, especially with regard to the transferring of case notes into the letter. In your chat box, let me know what those concerns are. Pooja is looking for listening tips. You can actually watch some of my own previous sessions, and other all-stars also have also given extensive lessons on listening, which are available on OET's official YouTube channel, OET Official, so you can watch them, Puja, for the time being. But there will be more lessons from all the all-stars on all 4 subtests. So make sure you use the extensive collection of lessons, the recordings in the OET's YouTube channel, and also available on Facebook. Yeah. So let me know how you work on it. How do you, make sure that you have proper sentences, and what all other things, which you should really be careful about while doing that, right? Yes, yes. So, I've just told you the most evident, obvious, and apparent transformation is that the notes become complete sentences. So today I'll be discussing with you things you have to do, and then we'll be together working on some short activities where you will learn by doing. Right. Hello, Aishi. Hello, 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 everyone. Those who have joined a bit late. I'm sorry if I miss some of your names, but I'll try to catch up. So let's get started. Be ready to type in your response and be really involved in this process, because only by doing will you really learn at a deeper level. Just watching might not be as effective as really getting your hands on the job and typing your responses, whether it's right or wrong. That's absolutely fine. This is a learning process. So here we go. So this is what we are going to do to warm up, and then we will have a little bit more of extensive activities as we go. So on the screen you have a tiny bit of the question, the case notes, which have a title diagnosis. Yes. So I want you to type in this in sentence form, convert it. Yeah, I'm getting a few questions, selecting relevant data. How many paragraphs? I'll just keep a tab of those. I'll address those questions at the end of the session. Deepika says she diagnosed with right lateral epicondylitis. All right. She was actually, Deepika, if you could just add that was, then that absolutely becomes right. Ms. Smith was diagnosed with right lateral epicondylitis. Yes, that was Concamore. Right, good. Michelle says she has a diagnosis of, now patient diagnosed with right lateral epicondylitis. Leif patient has diagnosed. No, the patient hasn't diagnosed Leif. The patient was diagnosed. The doctor did the diagnosis. Abita, Oswald, Shivam, right? Vidya, Fasrina. Okay, she is diagnosed with. She has right epicondylitis. That's Amir. Suresh, she was diagnosed with. Okay, Ria. Tin, Seema. All right, all right. Thank you, everyone. Just taking notes, which I will address later. But on the screen, you have a sample sentence. Ms. Mira Fernandez was diagnosed with right lateral epicondylitis. Yeah. Now, imagine as a health professional, you are able to, identify the condition, which is um, lateral epicondylitis, and if you're writing to somebody who might not require the technical term, the condition, but rather lay language, you can do that as well. For instance, you are writing to, let's say, social worker. So it wouldn't be wise to expect social worker to know what it is. So you can even write Miss Mira Fernandez was diagnosed with tennis elbow on her right elbow joint. So that, depending on the reader, you can translate your register up or down. So we'll be coming to that in a short while, but I have to mention it in this context anyway. So this process of converting the notes into sentences will continue throughout this session, but we'll be focusing on other aspects as well. So even while we address other aspects, this process will be going on. So it doesn't stop here, but as I told you, it's just a warm-up, but it will take you, to the next level as well. So now I'm going to move on to the next item, which is how do you deal with symbols? Now, if you look at any typical case set of case notes, you'll find a lot of symbols, right? For example, you have, as you see here in the image, up arrow, you may have down arrow, arrow to the side, all those things, other symbols as well, a lot of them, indeed. So you can't really use any of them, I guess. I don't think any one of you would use them. So for that matter, let's look at how you will handle the plethora of symbols that you see in your set of case notes. Of course, you have to, use words. So here is your first activity. Everybody hit the keyboard and type in your response for this. Now, initially, I want the words. What words come to your mind when you see this snippet of a case note? All right. I see increased pain in left arm. All right. Elevated perima, amna, vidya, pipika. The pain has been increasing in left arm. Surya, Param. Elizabeth says it's increased. Seema, Irwin, Apita. Okay. Anika, Ilvan, Ria. Yep. Brilliant. Jason, Anil, Tin, Shane, Michelle. Okay, excellent. So these are some of the words we can use: elevated, elevation, going up, increase, increasing, left arm. Now, once we've got this set of words which we could use, then it's easier to frame a sentence. For example, Keith has experienced increased pain in his left arm. which is actually something very close to what most of you did reply. So that's pretty cool. Excellent. So there's another example for you. So you have a question mark followed by HTML. Okay. Kankamal says probably possible. Surya possible short-term memory loss. Brilliant. Elena, yes, possible. Helvan, yeah. Mohammed, it's short-term memory loss. All right. Yes, Jason, Nancy, Elizabeth. Yeah, it's a query, absolutely. Sorry. Seema, Life, Nika, Sisso, Jason, Hilvan, Carla, Frida, yes, suggestive, yes, Suresh, Blassie, Anil, suspected STML, all right. Hanson says possible short-term memory loss, yes. Parima, Onkohim, Michelle, suspected to have short-term memory loss, yeah. Okoy, Ramzana, provisional diagnosis of short-term memory loss, yes. CISO suspected to have STML, yes. Ujunwa, so Lewis has a suspected short-term memory loss. Jamba, possible STML or suggestive of STML, suspecting that. Sansi Teres, Amir, Thomas Kuti, yes. Mercy, Mariamol Thomas, possibility of short-term memory loss. Onu Shioma, yeah, query, it's a query, absolutely. Nwasa, yes. Judith, good. Abita, yes. So I'll show you the words. Thank you very much for your active response to this. I did not use the word query because we will not be using it in this sentence. So you can use words like suspected, indicates, indicative of, possible, and STML, which is, of course, short-term memory loss. So let's now look at how it becomes a sentence. Chris' symptoms indicate possible short-term memory loss. Therefore, I'm referring him to you for a definitive diagnosis. Now, one important thing which I want you to remember is that if you have a query, do not write as if it's a diagnosis, it's a definitive diagnosis. So you might, write like what's given here, indicative of, or indicate, possible, suggestive of. You can use a number of options to show that this is what you suspect the patient to be having, and you're not sure about what the condition is, but this is your impression. So sometimes the word impression is interchangeably used in different contexts, but generally it points more of a suggestive, or an indicative, a query rather than a definitive diagnosis, although in some context it's used to to indicate a definitive diagnosis as well. So in such instances, make sure that you request that the reader is expected to provide you with a definitive diagnosis or to confirm the provisional diagnosis which you have made. So it shouldn't impact the purpose if you misrepresent it. So I hope I've just given you a brief idea on what to do with the symbols and how to seamlessly bring them into the letter. So initially, think of the words which those symbols could replace, and then we can easily use them in our sentences. And we're moving on to the third item in our list, which is grammar. Now, in the set of case notes have absolutely no grammar. You don't have to search for grammar. Grammar is totally missing in the case notes. But the letter is where grammar plays a huge role, especially one of the criterion heavily focuses on grammar, language. So language looks at grammar and punctuation, spelling and vocabulary. So if you are able to show a range of grammatical expressions, variety of tenses, it should really be good in scoring higher in that criterion. Having said that, you don't have to deliberately bring in a variety of tenses or structures because that might not look natural. But the purpose of grammar is to make communication easy. So that should be the back of your mind. So again, I'm going to get you involved in these short activities where we'll see how we can bring about these changes consciously. And later, all these layers of learning should blend in while you write an OET letter. So yeah, so you have again a note, R/V 1 month post pathology. Of course, you have to make it a sentence, and then we'll look at what sort of grammatical impact it has, or what grammar elements have been involved or included. It's your time to hit the chat box again. All right. Carla says she needs further tests in order to confirm suspected short-term memory loss. All right. I think it's from the previous one. I'm not sure. Okay. Suresh Bulli says she is due for review after a month with pathology reports. Shonila, I'll be revised post-pathology after 1 month. Okay. Shonila, can you convert that post-pathology into a complete sentence, because it still reflects medical jargon? Jason, it's a review. I'm sorry, it's not resolved. Frida says review 1 month after pathology. Yeah, it's okay, but it's not entirely, in a sentence form. Conkamall, a review of the result at a month is to be arranged. Okay. For Serena, I have planned to review her in 1 month with pathology report. Sally says you have to use future tense. Yes. Surya, she requires a review next month after her pathology has arrived. All right. Elizabeth, review after 1 month post pathology. Review, Anil says, review after 1 month with pathology reports. Leif, a follow up review after the result. Shivam, Mr. X will review after a month with post pathology. Okay, but still, I want a complete sentence, Shivam. That's what I would appreciate. And see, review in 1 month with pathology results. First one, I have planned to review her with pathology report. That's good, but the 1 month is missing though. Um, okay. Sally, post pathology, she must be reviewed in a month's time. Seema, she will be reviewed, must be reviewed, I suppose. Okay. Um, Excellent. Sorry, I can't catch up with all the responses though. Here's an example on the screen for you. Mr. Matthew will undergo further pathological examinations and he has a review appointment at the clinic in a month. Now, many of you did give me excellent sentences, which are pretty good, but make sure that the structure is not compromised. Yes, as some of you did identify, you have to use the future tense. All right. And he has a review because there is a definitive plan, in which case the present symbol can be used. But it has the meaning of a future event which is scheduled. So that's excellent. Brilliant. Thank you, everyone, for the response. And that was pretty overwhelming, to be honest. But I'll go through all of that later. Here's another one for you to identify, possibly, and also to convert it into a sentence. And we'll learn an important aspect as well, which perhaps you have not realized, and which could be applied. All right. So Ahmed says use the passive form. Joanne Cannon, it's important that. Irwin, it would be beneficial to monitor her adherence for medication. Is she, Mr. Smith has to be monitored for medication compliance. Dave, Mr. X should be advised to monitor his daily medication intake. Leif, it could be it could be an instruction or a recommendation to a health professional rather than perhaps telling the patient himself or herself. Helena, medical compliance should be monitored. Frida, kindly ensure she takes her medications as prescribed. Yeah, that's good. Sally says this is a request. Could you please monitor Mrs. or Mr. Smith for medication compliance? Okay. You don't count a compliance, it's not countable. So for medication compliance should be fine. Surya, I'd be grateful if you could monitor her compliance with medications. Good. Shonila, she needs monitoring regarding her medication compliance. I like an aspect of it, which I'm going to talk about, Shonila, in a moment. Although I would like you to replace the regarding with something else. Although, again, it's not absolutely wrong. And BG, it would be beneficial if you could monitor the medication compliance. We need to carefully monitor the compliance upon her medication, of her medication, I would suppose. So that was Ilvan. Michelle, may you ensure that she is adhere to her medication? Could you redo that? Kindly monitor Ms. Sex's compliance of her prescribed medication. So that's Jill, Amir, Elizabeth, Sarah, Fesrina, Suresh, Shani, Nwasa, Hanson. Sorry, everyone, I can't read all the responses. We have to move on, but as I've told you, here's a sample sentence for you. Your monitoring of our medication compliance would be much appreciated. With this example, I want to touch base upon a grammatical function, which is often overlooked, but at times it's important in a formal letter. Now, just let me know if anyone is able to identify what has happened to a particular word here. You find the word in two forms in the case notes and the letter. Identify which word it is and what has happened. If anyone could find out a word which exists in both the case notes and the letter, but in two different forms or parts of speech. And see, very good, it's monitoring. So what change do you see? Yes, Ishi, monitor to monitoring. Can anyone tell what that's called? What's happening? So this is called nominalization. So when a verb is converted into a noun, you call it nominalization, and this is a standard practice in formal writing. So now I'm not saying you cannot use verb forms, but in order to make it more formal, normalization can be a great tool. So monitor becomes monitoring. Um, please discuss, which into noun form would become a discussion. A discussion with the patient's family would be appreciated instead of telling, please discuss. So that should be something which you will take away. And moving on, fourth, we're looking at what happens to the tone and register. They become more evident. We are looking at some of the important changes that happen when the case notes are transferred to letter. In the meantime, if you really like this session, please share it with your friends or colleagues who might benefit, or someone who is preparing for OET. All right. Yes, Ali, that's right. So, what do you mean by tone? What is tone? What sort of tone would you like to have? For instance, in a letter, we should have a polite tone. Of course, there are other attributes which we will look at. Are you polite in your writing? That's very important. I'm sure that no one wants to sound rude or not to be polite, but sometimes it might not be pretty evident when you are not polite. So, can you choose which of these is polite? Option one or option two? Just type the number one or two. It was pretty easy, I guess, because I'm getting a stream of twos. All right. Another aspect of the tone is that it should sound professional. How could you sound professional? Can you think of sentences which are professional or not so professional? If you can't back your head around it, here's an example for you. There are two sentences again. All you have to do is choose which of these is professional. Yes. So, although again, expressions like above mentioned aren't wrong, it would be much better if you could specify. And telling someone to go up and read those might sound unprofessional for that matter. All right. Now, another aspect is that your sentences should be factual and non judgmental. Now, we do talk of being non judgmental in speaking as well, but it's equally important in writing. So, let's try it out. Again, you have two sentences to choose, and tell me which of these is factual. I'm getting a number of one and two together, so I think it's a mixed response. So let's see, here we go. The first sentence: Miss Emily is overweight and her hobbies are mostly sedentary, is factual. Now, when you brand someone as obese, and again, that she is reluctant to do any exercises is like branding them, it's judgmental. So such sentences and expressions should be avoided. All right. So let's now move on to the next aspect, which is we were looking at tone, now we are looking at register. Now, register is the appropriate choice of words. So, um, you know, the proper lexical selection is important. And OET letter being a formal writing, you have to make sure that the word choices are formal. So, let's now test your ability to identify formal register. So, we've got again another set of sentences for you to decide on which of these is having a formal register. It's pretty easy for most of you, I guess. All right, great. And as I had predicted, it was indeed easy, and I haven't got a single wrong response. So if you look carefully, you find need, help. These are informal word choices, whereas on the formal side, you have requires, assistance. So make sure you deliberately learn a list of formal words, especially the common ones that might be used in the OET's context. Now, one of the final items I've got today for you is how you regroup information. What do you mean by regrouping of information? The case notes, pieces of information would be scattered, so you will find them under different headings. Now, when you transpose it into a letter, you might have to pick pieces of information from different parts which are connected and then put them together in a sentence. So, this is again another skill which I want you to learn really well. So, here's another set of case notes on the screen for you. Um, have a quick look, give you a couple of sentences to read the set of case notes. And I've got two sentences. Can you tell me where you find a proper grouping? I guess the majority go for two, which is actually the correct answer. Ms. Norman's hypertension is well controlled with Ramipur 5 mg taken twice daily. Now, hypertension, you find it in past medical history, It's ongoing as well. And in medication, you will find Ramipral 5 mg BD. You have to bring them together, and that makes sense. Now, alternatively, you can indeed talk about the conditions, and later, if there are a lot of medications, for example, that can go in another paragraph as well, especially if you're writing a thematic letter. I'm not saying that's entirely wrong, but there are times when it's better to group related information together. So this is again a skill which would be of great help. All right, so here's another example. Can you group the information here? This is from one of OET's official samples. But I've just taken a few notes just to help you learn. I want you to focus on the work or profession, the professional part. Imagine I'm mentioning that. So give me a sentence from these notes about this patient's professional, realm. Muhammad, of course, DM is there. I was just giving you an example. It was not a complete paragraph for that matter. You'll have to mention it. Sorry. All right. Laif, IT consultant and works on a computer 6 days a week. All right. Surya, she's an IT consultant with a busy career using computers for about 6 days a week. All right. Ahmed says Mr. X has a demanding job which requires him to spend much time on screen. Okay. Yeah. Jana says Mr. Mark is an IT consultant. He uses computer 6 days per week and having a complaint of pain. All right. It's a bit lengthy, so if you could make it brief, I'd appreciate that. Pramila, Mr. X is an IT professional. He works 6 days a week. There's an inconsistency there with the sentence, though. Azza, the patient works in busy profession and exposed to computer 6 days a week. There's no exposure. We usually talk of exposure to, in this context, something that's harmful, but you could perhaps replace that. Ria, he's IT consultant and uses the computer 6 days in a week. Elena, Austria, Nancy. Right. So here's an example sentence. Smiles is an IT consultant who uses computers for the majority of the week. 6 days becomes majority of the week, which is far more it's better, it's more formal. All right. So we got a quick activity lined up again. If you're interested in having one-on-one sessions with IRS Group trainers, our expert master trainers will deliver one-on-one sessions for you. So please make sure you go to our website, irsgroup.in, and register your interest. We'll have a placement test for you or an interview to see what's your current level. And if you have previously taken the test, if you are a repeater, we'll consider your existing score as well. And then we will place you in the right course. So make sure you have the finest training from our expert trainers. And you'll also have access to free training material in our trial packs. Excellent. So let's now have a little bit of test, a mini quiz. I want you to tell me if what you see on the screen. You have seen case notes being transposed into sentences in a letter. Tell me if it's accurate or not. Because at the end of the day, what we want is accuracy. Whatever we have looked at, all the 5 aspects, and a number of other aspects, which I'm unfortunately not able to cover today, the ultimate purpose is to make sure that you convey the precise clinical and factual information to your reader. It is accurate. Yes. And if you have told me that it's accurate, is she Amir? Yeah, it's indeed accurate. Let's now look at another example. So it's part of a discharge plan. He continues to take diclofenac tablets 4 times a day for his pain relief. Yeah, Surya says it's not accurate. Mariamol says it's accurate. LJ Corbanchus says it's inaccurate. Jana says inaccurate. Anika says it's accurate. Ishi inaccurate. Hanson inaccurate. Waipu, all right. Tin accurate. Jamba inaccurate. Ujunwa not accurate. Elizabeth inaccurate. Excellent. Leif not okay. Waifu not accurate. Amos not accurate. Alina not accurate. Brilliant. So I think the majority are right and it's inaccurate. It's not accurate. If you look carefully, firstly, the diclofenac is PRN, which means to be taken as required. And it's not to exceed 4 tablets in 24 hours. So the letter is inaccurate because it gives the wrong clinical information about the medication. So this is paramount. You should make sure that what you write is accurate. While you are transferring case notes into letter, accuracy is not compromised. That is absolutely essential. So the gist of what we learned indeed is that what you do is accurate. All right. So I've got something like a homework for you. If you could later post in your chat box. I'm unable to show you the entire set of case notes, but this is again something from the IRS Group's exclusive set of writing content along with the 4 subtests. So this is for you to try and revise what we have done. And thank you very much for having me do this session for you, and happy learning. best wishes for your OET preparation, and hats off to the fantastic job you do as health professionals in these tough times. And at IRS Group, we are happy to provide you with a lot of high quality learning, which will help you to achieve great scores and be excellent communicators at your workplace. Thank you very much, everyone, for having me and IRS Group deliver this OET All Stars session. See you soon with another session. Thank you.